So let's move a little further. Think of another type of ultrasonic imaging to measure now not just structure, velocity of material or movement inside the tissue. What's moving inside our tissue? For example, blood. So the rate of blood flow or rate of wall motion of the heart, which can be helped by Doppler effect with the sound wave, which you probably know already from your experience in the station of a train. You know that the sound of incoming train versus going away train gives you a different pitch or different different frequency of the sound. And that changes in frequency or wavelength of a wave for an observer moving relative to its source can be utilized as a Doppler ultrasonic imaging for functional imaging. So, and another, which I'm not going to discuss it right now, but very interesting advanced ultrasonic imaging techniques involves first example as a photoacoustic tomography. As the name involves, photons generate acoustic source, and we can image with the ultrasound, or so that can create a tomographic imaging. So this is called PAT, which is an emerging technology that allows us for more functional imaging by combining the use of photon and detection as a ultrasound or sound waves. And another example as a advanced one as a functional ultrasonic imaging technique is now, because ultrasound is using the sound wave, and the sound wave interaction inside a biological tissue has a mechanical property. So that variations of mechanical property or elasticity can be also measured by functional ultrasound imaging. So based on elastic properties of the tissue, by measuring the change in the structure, which we call strain, when tissue is compressed or stressed. So strain-stress relationship gives the electricity, and we can even probe that elastic property of the tissue. And also, like X-ray, ultrasound also can have a contrast agent, which happen to be a microscopic or nanoscopic level of bubble, which is like 2 to 10 micrometer diameter bubble can become, you can flow them into the bloodstream, and that will generate a high reflection in ultrasound so that we can use it as a contrast agent. And also three-dimensional ultrasonic imaging is adding another axis of rotation of the transducer or arrays of transducer. We can now image in 3D more faster, and that's called 3D ultrasonic imaging. So now I want to just give you an example of advanced ultrasonic 3D, and 4D is 3D plus one more dimension, usually in time. So 3D is usually in space, like 3D structure, and the changes in time, if we collect the data, we call it four-dimensional ultrasonic imaging. So the first 2D traditional ultrasonic imaging, and we can create the three-dimensional ultrasound imaging. This is an interesting example of twins inside a mom's womb, and the differences between 2D, 3D, and 4D is in fact a movie. You can go to YouTube to see how 4D ultrasound looks. And at the last, I want to give you a kind of a recent update for 3D ultrasound imaging, even using a single sensor by use of so-called compressed sensing. So let's see, imaging by line. So we have a multiple of transducer and AD converter, and it can be assigned with a delay so that we can have line by line imaging using array. So let's say this ultrasound gives us a source, gives a sound that will be transmitted field, and then the receptive field will be exactly the mirror image. And those receptive fields will be detected by this multiple ultrasonic transducer, and and we can create this ultrasonic images. While there is also plane wave imaging using array, which means we gives the same phase of ultrasound, so unfocused transmission, and these structures will give out the reflection that receive a field, and so that we can have a parallel image reconstruction, which means we can have a total calculation, not line by line. However, you can see here an issue could be you need a lot of units of AD converter and a lot of piezo sensor. So an idea question is, can we make it even simpler by having only single transducer and single AD converter? And where can we pose more information? By using this, the ultrasonic transducer giving a different kind of compressive coding, which looks like a random, but you know what exactly is. And then it will generate unfocused transmission, and the receive field will be kind of weird, but it contains the information. Now you are collecting it over time, and that can give you a new single sensor imaging. So this is very cool, and I think there are many technological advancements so that which allows us to have a better and faster and high resolution imaging. Okay, so next time we'll discuss about nuclear imaging. Thank you for your attention.